Hi, welcome back to Health Sharing Show, YING, KANG, that brought to you by Decho Bio International, Sdn Bhd. I'm your host today, Leslie. Today, we are very honored to invite our special guests, Dr. Subra and Dr. Penny. Dr. Subra is a primary healthcare professional and general medical practice. Welcome, Dr. Subra. And Dr. Penny is Decho Bio Chief Nutrition Scientist who is specialized in phytochemical and bioactivities of natural products. Welcome both.
Hi, Mr. Leslie.
In the previous episode, we had talked about the anti-aging product that Mr. Lee Ka-sing is consuming. Today, we will discuss the second dose booster versus nutrition and immunity. The current coronavirus disease 2019 or COVID-19 caused by severe acute respiratory symptom coronavirus 2 or SARS-CoV-2. Despite that, more than 2 years have passed since the first appearance of COVID-19. The lifestyle, economic activities, the social behavior of our world are still being impacted by this pandemic. Great progress have been made in controlling the COVID-19 pandemic. However, much of the effort still focuses on reducing infection and disease severity by vaccination, which occasionally cause some adverse effect. Dr. Subra, recently, Health Minister Khairi Jamaluddin announced that individuals aged 50 to 59 who are without any comorbidities are now allowed to take their second COVID-19 booster shot. Do we need the fourth COVID-19 vaccination shot?
Actually, it's a good question that we need to consider, especially because a lot of things has happened. A lot of studies are now being undertaken. A lot of conclusions has been arrived to, but there are still many areas still unanswered. So when we talk about the first two vaccination, I think everybody is clear why we needed the first injection and the second injection. But when it comes to the first booster and the second booster or the fourth vaccination, is it really necessary?
Mm.
Obviously, this is a question many people have asked, even I myself have asked. But what we need to understand is one thing. When we talk about a booster vaccination basically refers to telling our body's immune system to ramp up the production of immunity so that our body can better protect us against future occurrences of COVID. So having said that, like I mentioned, there are many differing reasons, different opinions. Some have said it is important. Some have said, well, I'm not sure. Some saying, I will hold on. Let's see what happens.
Yeah.
So this has been going on for some time. But what we can say is that for those people who have underlying disease, for example, high blood pressure, kidney disease, lung problems, cancer, diabetes, and such like chronic diseases, it is advisable that they obtain the second injection. Of course, initially it was for those who are 59, 60 and above. But one thing we need to keep in mind is that a lot of people in the early ages of their life, even young people in their 20s and 30s, they are already contracting or starting to have the chronic metabolic diseases such as diabetes. So for such like ones, it's probably recommended that they take the injection or the booster jab. But then again, everyone has to decide for themselves what they need to do.
Right, Dr. Subra. So, have it developed a natural immunity against this COVID and others many variants?
Well, when we talk about the difference between natural immunity and one that is acquired following a injection, for example, or a vaccination, a natural immunity is one where the body itself produces the immunity. For example, if we think about our daily living, every day we could say that our body is being bombarded in many ways by bacteria, virus, and so on. But we don't feel sick. Why? It's because our body naturally produces the defense mechanism so that we don't get sick. But in other instances, we need to have the acquired or vaccine-induced immunity simply because our body is not primed or our body is not producing a very specific antibody against a disease. For example, COVID. Now, before COVID came into the picture, people generally did not have an antibody to fight against this. So many people were dying. Okay, but later when the vaccines came in, it sort of induced the body to produce specific immunity against COVID. So that is why we have to think about it very seriously. And of course, the other issue is many people wonder, with the passing of time, the COVID virus is also changing. So is it that the body is going to adapt? Or do we need to keep coming up with more and more vaccines or booster shots? One thing we really admire about our body, the way we are created, is that our body can also adapt itself to various types of variants. Okay, so it's not always that we need to actually have a booster shot. Sometimes our body can itself come up with the appropriate immune system to fight against certain variants.
Then how long after the COVID can a person that actually get for the fourth jab?
So again, here there's a lot of differing opinions. We need to keep in mind that a lot of studies are currently being undertaken. Even our own Ministry of Health is doing a lot of studies locally. Many of these studies are available on the ministry's website. A lot of studies are also being done in other countries. For example, in US, the Johns Hopkins University is doing a lot. Mayo Clinic is doing a lot. So when we think about when exactly do we need the fourth jab, there is no clear-cut answer. It's not like saying, okay, 2 months after the last jab, you should take it, or 1 month after the last jab. Because every single person is very different, like 3 of us. We are all individually different, and our own immune system is also very different. So we all react in different ways. Now, personally, I got the first booster shot in November last year. But I still ended up with COVID in May this year. Just 2 weeks ago, I went for my second booster jab. So, of course, there is some who say that we should get the second booster jab after 2 months, after 3 months. But then again, it differs from individuals to individuals. But it's always good to think about it, especially if you have underlying disease.
What is the impact of a COVID-19 on human's body?
This is a very important question because all of us, whether we get COVID or not, we are very concerned about our future health. The COVID virus has been shown to especially attack our lungs. And that is quite easy to understand why. Because for us, for humans like us, the 2 major entries of germs, of virus, or bacteria is through our nose and through our mouth. So the lung becomes then the first point where the COVID virus can attack. And it can leave scars or damaged lung tissue. So when this happens, then you can understand the recovery process is very slow and it will cause long-term problems. For those with heart issues, heart problems, COVID virus has been shown to cause inflammation of the heart muscles. And these too can cause long-term issues. For some people, they are affected emotionally, mentally, and kidney disease people also will be badly affected. So there are many areas of our life that the virus can actually have an impact on a long-term basis. For those who generally have, for example, shortness of breath, easily fatigued or feeling unusually tired. Okay, now these are symptoms of long-term COVID, we could say, and that can interfere with our day-to-day living. So we need to do a lot of exercise, for example, breathing exercise, and above all, we need to also take care of ourselves, our lifestyle, our food habits. And if we are in the industry where we travel a lot, like traveling overseas or domestically, and we are in the sales industry, in the manufacturing industry where there's a lot of interactions every day, then it'll be wise to also have our masks on.
A healthy and balanced diet is widely considered to be essential for improving the immune system. During the COVID-19 pandemics, it is often said that eating certain foods can boost immunity. Does this actually make sense? Let's explore this topic later. We'll come back. Welcome back to YING KANG Health Sharing Show. It's still me, Leslie, and we have Dr. Penny and Dr. Subra with us. Now we would like to go to Dr. Penny. Dr. Penny, a healthy and balanced diet is important because it provides you with enough energy and nutrients to keep your immunity system functioning properly. Malnutrition can impair immune function. So, is there a single food or nutrients that can boost human immunity and even prevent infection with the new coronavirus?
Thank you, Mr. Leslie, for the question. I would like to relate this question to Mr. Subra, that he answered the question previously. Yeah, previously was asking, do we need to keep on taking booster? And Dr. Subra, the answers that our body were able to produce the antibody to tackle the changes of different kind of variant. Yeah, so that's very important. But in order for us to do that, we need to give our body a very strong nutrient and also food support. So there's no single food or nutrient that can just support the immune system, because different food will give you a different nutrients. In fact, they give you a combination of different kind of nutrients, vitamin, minerals, phytochemicals, and all these nutrients and phytochemicals, they will work in synergistically and to support your immune cell in different stages, because we have many kind of immune cells. Now we got the T cells, we got B cells, we got natural killers, we got phagocytes. So all this, they will use different kind of vitamins and minerals. Yeah. So especially we have to take more fruits and vegetables, at least 5 different kinds of fruits and vegetable a day, which they will give you a different kinds of vitamins and also minerals. And also another point that we have frequently and commonly forgot is probiotic. Yeah, probiotic is one of the important ingredients that we have to incorporate into our daily diets, because in our body itself, actually our guts bacteria, the bacteria that are actually living in our gut, is closely related to our immune system, our immune health. Yeah, and in fact 2 kg of our body weight actually is contributed by the bacteria that living in our gut systems. So it's almost equivalent to 10 trillion kind microbe that living in our gut systems. Yeah, and easily in our gut system itself, our digestive tracts, that's living more than 1,000 kind, more than 1,000 kind of different species of these bacteria itself. So digestive, and it's very importantly that we have to understand that 70% of our immune cells actually is residing in our digestive tract. Yeah, that's why it's very important that we have to ensure a different species, a diverse kind of bacteria living in our gut system. Yeah, and how to make our the different kind of bacteria, different species to grow in our gut system is we have to take in different kind of fiber. So fiber is very important. Fiber is actually a prebiotic. Prebiotic meaning to say is a food that to grow the good bacteria. So it's very important we should take different kind of fiber. So this we will get it from your fruit and vegetables. That's why it's very important to take different kind of fruit and vegetable, at least 5 different kind of fruit and vegetable, especially the vegetables and fruits that with very colorful, red, yellow, oranges, green colors. So that will help you to grow different species of bacteria in your gut systems. And other than that, also try to incorporate more probiotic food into your daily diets. For example, like yogurt, or maybe those cheese, or take those fermented fruit like kombucha, tempeh. Okay, so these are the probiotics food that we should incorporate into our diet, so to give us to grow our bacteria.
Then doctor, what nutrients can actually improve immunity?
Yes, correct, Mr. Leslie. Of course, we will say that there's no single nutrients that can provide immunity. In fact, we have to take in different kind of nutrients, especially like vitamin C, vitamin B, vitamin D, vitamin K, and then zinc, selenium, and copper. Yeah. So let's start with vitamin C. Vitamin C is one of the vitamin that very commonly we will discuss about. When we have COVID, we take vitamin C. Or when we have flu, we take vitamin C. In fact, if we want to be pretty, fair skin, we will take vitamin C as well. Vitamin C is one of the very commonly discussed and important nutrient is because it's a super antioxidant. So when vitamin C is a very powerful antioxidant where it's able to control the inflammation. And also it's very important because it will able to boost a kind of immune cell that in our body. That immune cell called phagocyte. Phagocyte is a first line immune cells that whatever bacteria or maybe pathogen or maybe abnormal cells that happens in our body system, this first line immunity will come into attack. So vitamin C is particularly boosting the first line immunity. And evidence have shown that high dose of vitamin C, you were able to reduce the lung inflammation that caused by virus, for example, like COVID or maybe H1N1. Yeah? So you can actually take in more those highly contained vitamin C fruit, okay, especially acerola. Acerola is the champions of having the highest vitamin C. Every 100 grams of acerola, it will able to provide you 1000 mg of vitamin C. Okay, followed by sebatom. Every 100 grams of sebatons, it will able to provide you 450 mg vitamin C. And sometimes we will say, oh, you know, all these are expensive fruit, it's not locally available. Then you can look for guava. Every 100 grams of guava, you will able to provide you about 228 mg of vitamin C. And you also can look for like local fruit like papaya. Every 100 grams of papaya, it will give you 60 mg vitamin C. Other than that, you can look for like vegetable like broccoli, kale, snow pea, all these are highly available. Okay, other than that, lemon and also oranges. Other than that, vitamin B also important, where vitamin B is actually to help us to produce immune cells. So that's why we say is that different nutrients they play in different role. So especially vitamin B6, vitamin folic acid, B12. So this will help in producing immune cells, and you can get it from meat, egg, milk, fish, salmon, nuts, seed, poultry. So these are highly available, contain of vitamin B. Okay. Other than that, also vitamin A is very important, where it will help in support the T cells, where T cells is the one that will come into your system, that will recognize the pathogen, and it will destroy it. You can get it from these carrots. You can get it from this tomato. In fact, you can get it from animal source like the liver, okay, milk, all this. So another thing is very important is the zinc. Zinc is the minerals that very important for your immunity, where zinc actually is help you to mediate the first line immunity. Okay, then you can get it from seafood like oyster, crab, lobster, okay, or you can get it from like grains, dairy. Yeah, so these are the nutrients then and also the food that you should take in to improve your immunity. So still come back to our our first session. We are talking about the variety. Take different kind of fruit and vegetable in a day, so that it will supplement you with the adequate vitamins and minerals to support your immune system.
Then beside vitamins and minerals, what new discovery has recently made to help immunity, especially during this COVID-19 pandemic?
Before I answer to this question, we have to understand that during the COVID, there's few critical points that we have to be careful in order for us to know to how to manage the COVID-19. First thing is to handle the entry of the virus by wearing masks, by sanitize your hand. Secondly is to control the replication of the virus. That is the second critical point to stop the spreading of the virus into our other part. And the third most important critical point is to control the inflammation in our body. And what actually causes damaging to our body system is the severe inflammation that happens in our body. We call it cytokine storm. Yeah. So when we discuss about this is there's very interesting. We call there's found China. They found one particular herbs that have been traditionally used in the Asian country in treating the respiratory system, which is cordyceps sinensis. Cordyceps is 冬虫夏草啦，冬虫夏草. This is very commonly Chinese. We really know it very well. And this cordyceps sinensis is very useful, and that have been shown that able to control the cytokine storm. Meaning to say the chronic inflammation that happen in your body. COVID is not scary. It's the chronic inflammation that's killing. It will damage especially your lung and also your other organs. And because of this multiple organ failure, that's caused death in COVID. Yeah. So in order to handle the COVID, the most important thing, you have to control the inflammation that happens in the body. So cordyceps sinensis, it shows that able to control the cytokine storm, which is the chronic inflammation, and so that it will help to reduce the fibrosis in those that COVID patient. And also it is a very important immunoregulator. Okay, not immune booster itself, immunoregulator. Meaning to say, when our body is very weak, alright, so this cordyceps sinensis were able to boost up our immune system to fight against it, like by activate the systems of our immune cell, increase the number of antibody that are available in our system, increase the strength, okay, the activity of phagocytes in our body, and then increase the numbers of killer cells. Okay, when up to one stage, right, our immune reaction is too severe, it will start to damaging, it will cause a lot of inflammation in our body and start to damaging our organ. And this immunoregulator will actually tune down the immune response, okay, by cutting down the number of immune cells so that it do not cause damage to our body. And cordyceps sinensis is a very good immune regulator. So this cordyceps sinensis has been shown in a study in China, 2010, among those adults that 50 to 75 years old, by using 12 weeks of supplementation of cordyceps sinensis, it able to increase the number of natural killer cells in them, and also it are able to boost up the exercise performance and also the metabolic and ventilator capacity among the subjects. So this is especially related to COVID patient, because once we contracted COVID, after that we find that we have this difficulty in breathing, shortness of breath, weak institution. So thus cordyceps sinensis have been shown in the China studies, it's able to do it. Yeah, and in China as well, also in the year of 2007, by taking 1.5 gram and 3 grams of cordyceps sinensis, it were able to help in those adult with the moderate asthma. Yeah, by 2 months supplementation, it were able to reduce the serum markers of inflammation in the airway. So this is very important for COVID patient, because very commonly we found that COVID patient, after they recover, they will suffer from the post-COVID symptom. They have difficulty in breathing, they have the symptom of asthmatic. And another one that's very interesting that I would like to introduce is the tiger milk mushroom. In Malay, we call it cendawan susu harimau, and it's very commonly that discussed among in traditional use in this Southeast Asia. And according to the Fox law, where this tiger milk mushroom will be growing in the spot where the female tiger nursing the little cubs. So where's the milk dropping on the ground, that's the place will grow the tiger milk mushroom. So this has been traditionally used in our those Aboriginal Orang Asli, especially among the Temuan. The Temuan Orang Asli will use this tiger milk mushroom to treat anyone that with the cough and also asthmatic. Yes, and also to strengthen those people have a very weak body. And according to very proudly we say that in a recent study in the year of 2021, there's a study have been done in Dr. Tan Chun Kiat from the UCSI. It has been shown that tiger milk mushroom, able 3 months supplementation, taking 3 months, it were able to improve the respiratory health and also the immunity and antioxidant in the body. Yeah, so tiger milk mushroom actually is the national treasure in Malaysia. It's really our harta benda lah. So it's something that we are very proud of.
Apart from nutrition, are there any adjustment in life that actually can activate our immunity?
Yes. So besides the nutrients and also vitamins, we also very important that our lifestyle is important. Okay, make sure we have adequate sleep. So long-term staying up late and not that getting adequate sleep will cause our body weak, and easily we were susceptible those of virus infection. Yeah. So for adult, we have to sleep at least 7 to 8 hours. For elderly, we have to sleep at least 6 hours. For children, you have to sleep at least 8 hours and above. Exercise is very important. Okay, exercise have been shown that able to make white blood cell to circulate more quickly in our body system. So our immune cells is the white blood cells. The faster it will circulate in our body, the faster it will able to pick up those that bacteria or pathogens that are in our body. So from there you will strengthen your immunity. So at least have to engage in exercise at least 5 times in a week. Each session should maintain at least 30 minutes to 60 minutes. Just start by a simple exercise, just 10,000 steps per day. Or maybe if you cannot get 10,000 steps, just 6,000 steps will do after your dinner. Or another one that is very important and very deficient in our Malaysian country is the sun exposure. Okay, even though we are living in a country of Khatulistiwa, but we are afraid of exposing to sunlight. According to UKM, a search on 2022, this year research, it found that a lot of us actually vitamin D deficiency, and especially among the Malay and also female, because they cover their body. And it shows that actually by regular exposure to sunlight, it will able to reduce the infection of the influenza virus, and also to reduce the numbers of respiratory disease. For example, like sore throat, cold, or nasal congestion. As I mentioned, okay, vitamin D is an immunomodulator as well. So try to expose to sunlight, okay, 10 o'clock in the morning, or maybe you can choose 3 o'clock in the afternoon. Yeah, these 2 sessions will have the lowest UV light, and each session do not more than 30 minutes. And last but not least, always smile. Okay, according to the Stanford University, it shows that actually laughter able to increase the numbers of antibody and also immune cells in our blood and saliva. So this is a free immunity booster. You can actually help yourself to boost your immunity just by laughing, being positive thought, yeah, being happy and control your emotion. But somehow some people, maybe because we are very stressful, because we are living in a very stressful lifestyle, especially in works. So if you feel that really you're not able to control emotion, I will actually suggest advice to our audience online. Yeah, look for professional help. You look for a counselor, look for professional help to help you to handle your emotional stress. Yeah, so this is 4 points very important: sleep, exercise, sun exposure, and also laughter.
Yes, doctor. What is the best the lifestyle nutrition recommendation for those mild to moderate COVID patient?
Yes, this is very relevant question, because nowadays when we have contracted COVID, especially mild to moderate, we are quarantined at home.
Yes.
Yeah. So according to the latest research, they are looking for the integrative management. Yeah, means not only by using medication to control the COVID patient, but also integrative way, using different perspective or different way to actually helps to manage the COVID patient. Yeah. First thing is the nutrition, as we mentioned. Okay. Take anti-inflammatory diets. Anti-inflammatory diets, we have mentioned it before in our previous session, Mediterranean diets. So a diet that highly consists of fruits and vegetables, and also those seafood, and also egg, milk, olive oil. Yeah. So at least half of your plate should consist of fruits and also vegetables. Protein is very important. Yeah, because during COVID, okay, our body actually try to fight all this coronavirus in our body, and they will start to making a lot of immune cell, and all this immune cell needs protein. It will use up a lot of proteins when we are contracted sickness. But very sad to say is, according to research, those that hospitalized patient because of COVID, 70% of those hospitalized COVID patient, they're actually deficient at least of one nutrient. So ensure you must have taking high quality protein, at least 1.2 to 1.5 gram per kg of body weight. Meaning to say, if you are 60 kg, then you have to times 1.2 gram. Then you will know that how much protein you need to take. Glutathione has been shown is very important to antiviral property. As I mentioned earlier on, okay, when the second critical point when the COVID enter our body is we want to stop it from replication. So that is called antiviral. In terms of herbs, we have introduced before Cordyceps sinensis, tiger moon mushroom. Okay, other than that, astragalus, huangqi, the one that we also discussed before for the telomere one. Yeah, that's also very helpful. Or even the black garlic. the black garlic. Black garlic is a fermented garlic, which very high in antioxidant. Yeah, and also exercise is important. Okay, especially those COVID patients, they will have difficulty in breathing. So you can practice qigong, the breathing, at least like 20 to 90 minutes in a day, or some breathing exercise. Okay, like Tai Chi breathing. 我们讲太极运气. If you don't know qigong, you don't know Tai Chi breathing, then you just sing you become a toilet singer. Yeah. So you sing yourself out, you sing out, right? That will actually make you laugh, happy, and also it will help you to exercise your breathing. Or maybe aerobic exercise, just 15 to 30 minutes in a day, 3 to 4 times in a week. That would be helpful. Other than that, stress reduction is very important. One skill is very important that we need to learn is stress reduction skill. Previously, we do not emphasize that, but we find that a lot of people actually having this, depression issue. So then, especially during COVID, so we have to very important know how to, handle stress. You can do meditation, yoga, Tai Chi, or simply guided imaginary. Meant to say you are lying on the bed of COVID quarantine 7 days, then you start to imagine, I go seaside lah, I go shopping lah, alright? So you just by feeling relaxed, or maybe, by expression art, right? You drawing all these things, or simply aromatherapy would be helpful, lavender essential oil, yeah, or go more to nature. So these are the integrative way, not only by medication, but also by your different of tips. It will help you to feel better and recover better when during the COVID, especially the mild and moderate.
Okay, thank you, Dr. Penny and Dr. Subra. In conclusion, both second dose booster and nutrition are very important, as long as our immunity is stronger enough to fight against virus. Next episode, we will invite a prominent figure to talk about the severity of post-COVID-19 symptoms after recovery. Believe that most of us now know about him, especially in the past 2 years of COVID-19 pandemic. Stay tuned for our next show. See you.